Very good evening to all. I'll be showing a very interesting case of OSSN which presented like a vascularized corneal opacity. So this was the case. 71-year-old male presented to us with a gradual diminution of vision since 1 year and presented with this white mass over cornea and was referred to us for optical penetrating keratoplasty. So what it is vascularized corneal opacity or ocular surface squamous neoplasia. So look carefully. So arborizing pattern of vessels is suggestive of feeder vessels and it is arising from limbus. So it is more likely to be OSSN. We went ahead with AIOCMTC4. We could see feeder vessel and the opacity is above the corneal epithelium as we can see over here. So to confirm this, we sent the impression cytology, and impression cytology was suggestive of presence of atypical cells and diagnosis of OSSN was confirmed. So we started, as the patient was entity of corneal OSSN, so we started the patient on medical management. So we started the patient on mitomycin C 4 times a day, 0.02%, 1 week on, 1 week off, 1 cycle. So after 1 cycle, we can see the mass has drastically reduced. After 2 cycles, only bit of opacity is there. And after 3 cycles, we can see it is completely gone. So here is the comparative pictures. We can see the mass is completely gone with the medical management, which confirms. So take home messages, OSS is not always limbal. We should be always careful. All vascularized opacity are not always benign. Careful clinical examination helps in suspecting, and in rare cases impression cytology may help in diagnosis, although OSSN is more of clinical diagnosis, and medical management is first in predominantly corneal OSSN. Thank you.
Any questions from the house?
So, sir, it is an unusual presentation. So this is the. Yes, sir.
So I have 2 questions for you. One is why you stop the medicine, like why you do in like 1 week and then 1 week off. Usually few people prefer, like I prefer 4 days and 2 days off and then again 4 days, 2 days off for a 1 month. Yeah. Second thing is, how is your experience with 5-fluorouracil?
There are a lot of regimes have been explained for mitomycin C, like Dr. Navar gives for continuous 3 weeks, many other people give 2 week on, 2 week off, some people give 3 days on, 3 week off. So there are various regimes have been explained. In our practice and our experience from where I have learned from PJ Chandigarh, so there we used to give 1 week on, 1 week off, 4 cycles maximum. So and that's working very well in our hands. Definitely, I don't have any experience of 5-fluorouracil, but reliferon we have been using in such case, interferon basically, and they also have a very excellent result in these cases, because if but I personally feel it has a slow onset of action. It requires to be given for longer duration. In this case, we gave mitomycin and it has a very good response. If the response has been slowed, we could have added with interferons also, and that could have saved the day.
So if in 1 month it doesn't resolve, do you go for the surgery or you repeat the cycle after some time?
Basically, we can switch the medical management we are giving, because in surgery, in cases of corneal OSSN is a bit tricky, because we cannot remove it completely. We will remove it and we do alcohol epithelectomy. Also, there are chances of residual, and we still need to give medical therapy post-surgery also. And also the chances of limbal stem cell deficiency in such cases is very high. So I personally feel if we can manage it medically, and in my experience we have treated many corneal OSSNs and they usually respond better than the limbal ones with medical management.